You know, we like to say also that your nose is kind of like a building. And for us, what we find is a lot of the closed techniques rely very heavily on taking away tissue, on taking away cartilage, on cutting back the septum to try to rotate the tip. And for us, that doesn't make any sense because it weakens the nose ultimately. And the real important thing in long-term results is about building more structure and support.
Yeah, the problem with that sort of idea of removing cartilage, I think where we really get excited about this conversation, is it's a really philosophically important point to the whole practice, is we want as much control over a procedure as possible so that we're able to not only accomplish the result but make sure that it stays that way. And that's what open rhinoplasty allows us to do. We use suture techniques where we're not burning bridges. It's not like you're removing some cartilage and oops, if you took too much or too little, now you really have no other options. You're suturing the cartilage into the shape and into the position you want, and you're fixing it in that position. So once surgery is done, you know it's going to be there. You know it's going to stay that way. You're not waiting and hoping and keeping your fingers crossed, hoping that the cartilage doesn't fall too far back or too far forward. We never get patients who notch or over-rotate because the tip cartilage itself is fixed into the position we want it to be in, and it's going to stay that way.
Yeah, to go back to that building analogy, it's a bit like closed rhinoplasty, making a building smaller by cutting away some of the foundation. It works. That foundation, that building will settle down into the ground, but it's not going to settle necessarily the way it was intended. And that's where you can start to get shifting, and you can start to get things happening over time that were not intended. And patients come back 2, 10, 5 years later like this. For us, that should never happen. And those things never do happen in our practice. And it's because of the way we approach noses and what we're doing.
And it's important for patients to understand when you talk about open and closed, the differences in terms of how much tissue is actually dissected is not that much. You know, you have to understand whether you do open or closed, you're going to elevate all of this tissue. The difference is with the open, you're also elevating this area, so you're popping the hood. You're able to look underneath and actually examine the tip cartilage in its natural position. A lot of patients, I think, have the misconception that you're sort of degloving, you're pulling the skin back, and it sounds horrible, and they think that obviously that would result in a lot more swelling and things like that, but that's really a misconception that's been put out there that's not real.
There's another idea that is out there that open rhinoplasty takes a lot longer to heal, that there's a lot more swelling associated with it, and it's just not true. When an open rhinoplasty is done properly, it actually allows us to dissect in the correct planes, where we know we're right on top of the cartilage, right on top of the bone. We're not getting into the soft tissues and causing trauma to the tissues, causing excessive bleeding or bruising. And so in fact, we find that for most of our patients, within a week, they're back to work and feeling sociable and very comfortable.
And as far as technique-wise, also, a really important part that a lot of patients don't understand is if you've got that bump, part of it's bone, part of it is cartilage. The really important thing that an open procedure allows is when you remove some of the cartilage in this middle part of the nose, the mid-vault area of the nose, in an open approach, you're able to suture that septal cartilage back to that side wall and make sure it stays that way. In a closed technique, the hope is that the mucosa underneath is holding that position. Unfortunately, for a large portion of patients, maybe 20–25%, one or both sides, that middle wall can fall in. That's what gives that pinched look. It causes real breathing problems. It's what's called an internal valve collapse. And it should really never happen in rhinoplasty. And in an open approach, the way we do it, it never does.
So if we haven't made it clear, we love open rhinoplasty. We think for most patients, in most situations, it's unrivaled in what we're able to accomplish. And that's doubly true for a revision situation. There really should be no revision rhinoplasty that's done through a closed approach, especially if there are issues involving the tip, because the amount of control that a surgeon's able to have around that procedure diminishes greatly.
Absolutely.